Gracias, Alberto. And we have now a very special guest who, amongst other things, is also married to the amazing Rosa Ophelia Pelayo. And that's my good friend, Dr. Eduardo Scholcoff. And here's a little bit of Dr. Scholcoff's background. Dr. Scholcoff's been an interesting afternoon, my friend.
I know. I got it first. You know that I got hacked first. And I have to get help from Nestor to be able to do it like 6 weeks ago.
Oh, man. Before
they do all these locks and so on. Then, but we were able to, and we got famous in Immunotech for being hacked first. Sorry.
well, it's been interesting. It's a little extra. Anyway, good to see you. Let me tell everybody a little bit about you. First of all, Dr. Scholcoff, amongst other things, is currently a professor at the famous Northwestern University in Chicago. He is a professor of clinical family medicine. In the past, he's been a former director of maternal child health care, as well as working with the Cook County Health and Hospital System, Department of Family and Community Medicine, and he's also a proud Immunotech distributor. So welcome to the call, Doctor.
Thank you very much. Do you want Keith to wait?
No, go ahead, Doctor, and we'll see what we can do.
He's got his security hat on now, so hopefully we'll get through this.
Don't worry.
I have a couple of questions for you, Doctor. Number one, why should everyone take Immunical?
Well, we were talking with Dr. Aliagas. We have an autoimmune disorders and glutathione today. You know that we start these Saturdays in Spanish with Dr. Jimmy Goodman about who has to take it and why. Well, let's suppose that I tell you that your immunity will bump up and you will get to the level, I'm more than 60, I'm 67, and I will get to the level that the governments in all the world are saying, wash your hands, be sure that you have a cover and so on, and get a good immunity. Then today, immunity. The second one is most of our healthcare challenges are related to oxidative stress and are related to the lack of glutathione in certain cells. If you increase the glutathione by giving the cysteine donation, you will improve that cells. You can talk from operative, from pre-op, that I used to do surgeries a lot. I used to do sections and surgical gynecology surgeries and obviously the outcome is much better. But moreover, what happens if you have, because you are deoxidized and somebody has diabetes, you need less insulin because deoxidizing your muscles means that for the same amount of insulin, you will need less amount of insulin to have your same level of sugar. And I can go on and on and on about how important is to be deoxidized. Means oxidation is our problem. When you get your phone and they told you not to get your phone more than 10 minutes in your ear, is because your brain is getting oxidized. Well, what we do with increasing the glutathione is to get that oxide out and clean your cell from free radicals. From that, If you want, I can talk. If you give me 25 minutes, I can talk about cancer, another 20 minutes to talk about asthma and other related diseases. I was in Northwestern Library researching with the librarian because I never thought that I will find something, and I didn't believe in Dr. Pelayo because he was part of the company. Then we did a search. Before this book comes, we did a search with all the things that you have in the book. Then a month after I learned about these, and I say, well, how somebody that is not a doctor do not read every journal of her specialty, like is Rosophelia, that who present these, all of a sudden somebody present to you something that will change your life. And I'm a little the black sheep. The truth is, I do not mind to be the black sheep if this will improve the life and the care of my patients.
So let me ask you another question. Obviously, you know a lot of doctors, obviously, doing what you've done for a living all of these years. Why should a medical professional, be they a doctor, nurse, chiropractor, et cetera, why should they consider Immunotech as a business?
Well, first for the patients and the families, yes. First of all our families take this. I'm 67. I'm still doing very well. I do not have the pain that I used to have. I have osteoarthritis. I used to have pain in my right shoulder. Then first of all, the families, the friends, and their own patients. The second will be how important is to have a plan B. You know that in the States, doctors makes very good money. But I used to, as you read, I used the director of maternal child at Cook County Hospital. I used to go at 7, meet with the chairman, get the first meeting at 7:30, go to the clinic, supervise resident, see patients in the afternoon, and I will get back home at 5 and then answer phone calls, write evaluations for my faculty and my residents, and finally be able to go to bed to again and again. Then this is not only something that you have to do for your friends, for your family. Everybody has to take this, John. This is no doubt. I can show you plenty, but also it gives you 2 or 3 things that I don't think that we mentioned. Number one, gives you a very good reputation. When I start using this in my patients, nurses want to switch their mothers to me. Number 2, allowed you to have a better life. I was talking, I do not know if Jim Spencer is here, but I was talking with him about how long, it used to be that I get to Saturday to good, I will be able to update everything. We do not work 30 hours a week. We work 60, 70. And number 3, you choose the people that you work with. You sit down in every meeting with Jose Carlos, with John Sollder, with Alberto, with everybody that you love that is in the same business, but we are like friends. We do not, at county, you have to tolerate some things, yes? Well, here you do not tolerate. You are an independent consultant. It was enough that I get to the diamond. I was able to make a plan to leave the hospital because I thought that this was more important. And then I start doing breakfast for doctors and healthcare professionals. Will I make more money? Probably not. Do I think that every doctor has to know immunocal? Yes, I do. I think that it's not fair for a kid to be autistic and not being able to get some help from the cysteine donation. This is what my thinking is.
So let me ask you another question, because I know you and I've discussed this, and I'll be 59 the end of this month. So I know you and I've discussed this. I asked your opinion on it, but I think it could benefit all of our men and all the women on the call who are married, their husbands as well. But talk a little bit about our Magistral product and how you use it and why you suggest that strongly as well.
Well, the combination of deoxidation of your prostate with Magistral, that is a very peculiar product. It's probably the only liquid form that I know of the sopalmeto with other things. Then it will improve not only your prostate, will improve the erection, will improve the ejaculation, and unbelievable, if you are learning Spanish, then you will be able to come. I will do the secrets of immunocal in 2 or 3 weeks. Unbelievable if you see why people has premature ejaculation, not being 60, being 23, you will realize that the combination of immunocal, the oxidation, with sopalmeto allowed you to overcome these things that probably 10 to 20% of the people, I know that everybody start laughing with the secrets of immunocal and sopalmeto, but Magistral is a product that we have in the United States that probably is the best product, not only for erectile dysfunction, but also for all the symptoms of benign prostatic hypertrophy. You give somebody today at 8 o'clock 1 cup of Magistral, and because it's in a liquid form, it will decrease the number of urination that has at night today, not tomorrow. Then it's a product that is unique. It's a little more expensive than some other products, but is for sure the best product. I used to use other products, and I use Magistral a lot.
Great, great. Final question, doctor. So obviously, besides Immunical and Magistral, I'm sure you have another product or two that you'd like to mention that you think everyone here would benefit from.
Optimizer and Immunocal Platinum, by far. I will not talk about Cogniva because it will take, and I invite Jimmy Gutman that, this product has sulfatidylserine that in Germany they use it for neuropathic pain and so on. Then Cogniva is a very, very, very peculiar thing that I use a lot, but you have to know that it's not only for the cognition. If you put Jimmy Gutman, we need an hour and we will talk about Cogniva. But really, Optimizer is a product that has nearly everything that you need to combine with Immunocal. When you go and search for sulforaphan, that is a product from broccoli, it's a very, very strong concentration of what we call epigenetics of NRF2. And it's a way to, this goes to the nuclei, turn on the molecule that you need in your cytoplasm to produce Immunocal. Then you have both things. One that makes this famous RNA that goes to your cytoplasm to make a lot of glutathione, and you have the building bodies of glutathione with Immunocal. Then I think that is probably another best product, not to mention Immunocal Platinum, that we have another 25 minutes to talk about our Olympic teams, including our soccer team in Canada that use these. Everybody use it preventively, then for prevention. Then these are not little products, but obviously Immunocal, what it is very difficult to opaque it, then really these, I would say all four will be immunocal platinum, optimizer, and probably for me will be Magistral.
Great. Well, Doctor, I want to thank you. And once again, I apologize for the disruption. But
I hope that the English team will invite me to do some little talks only for medicine. Today we talk about autoimmune disorders and glutathione, and it was a very, very good talk with Dr. Carlos Aliaga from Peru. Thank you, and thank you all. Thank you very, very, very much for inviting me.
well, thank you, Doctor, and have a great weekend as well.
Yes,
Appreciate your time as always.